Hello guys, to be honest, explaining Alzheimer is not an easy task. Before I talk about Alzheimer, I should talk about dementia first. Dementia is a series of symptoms that can be caused by several disorders and affect the brain. People with dementia have significantly impaired mental functioning that affect normal activities and relationships. While memory loss is a common symptom of dementia, memory loss by itself does not mean that a person has dementia. Doctors diagnose dementia only if two or more brain functions such as memory and language skills are significantly impaired without loss of consciousness. Some of the diseases that can be present, the symptom of dementia are Alzheimer's disease, vascular dementia, Lewy body dementia, and Huntington disease. So, by this introduction, let us start with Alzheimer's disease. Alzheimer is a disease of later life. Approximately 6 million people in the United States aged 65 and older live with Alzheimer's disease. Among those, 80% are more than 75 years. The early signs of the disease include forgetting recent events or conversations, and as the disease progresses, a person with Alzheimer's disease will develop severe memory impairment and lose the ability to perform everyday normal functions such as trouble with one's familiar tasks, problem with language, and disorientation of time and place. Early onset of Alzheimer's disease is a form of progressive interrupting brain condition that appears in people before the age of 65. Trisomy 21 is the risk factor for early onset dementia. The most common sign of Alzheimer is loss of memory, depression, anxiety, lack of interest, enthusiasm, or concern, social withdrawal or lack of social relation with one's family and friends, mood swing or a sudden or intense change in an emotional state, distrust in others, irritability and aggressiveness, changes in sleeping habits, wandering, delusion such as believing something has been stolen. The question is, what are the risk factors for developing Alzheimer's disease? Increasing age is the most important risk factor for Alzheimer's disease. Traumatic head injury, poor sleep pattern, excessive alcohol consumption, depression, cardiovascular and cerebrovascular disease, higher parental age, lack of exercise, obesity, high blood pressure, air pollution, family history of dementia, some genes, and increased homocysteine level are risk factors for Alzheimer. There are three stages of Alzheimer's disease, and it takes about 7 years or more to complete the entire stages. But in general, symptoms slowly become clearer after 2 to 4 years. The first stage is preclinical with no symptoms. In this stage, individuals have no symptom, but there is definite laboratory evidence that includes plaque forming, which is caused by beta amyloid. Beta amyloid is a fragment of a larger protein. When these fragments cluster together, they make plaques that have a toxic effect on neurons and disrupt cell-to-cell communication. Another problem is tangle. Tau protein play a part in a neuron's internal support and transport system to carry nutrients and other essential materials. In Alzheimer's disease, tau proteins change shape and organize themselves into a structure called neurofibrillary tangles. These tangles disrupt the transport system in the neurons and are toxic to cells. The second stage is mild cognitive impairment. In this stage, patients have mild impairment in either memory or in non-memory function such as language frequency or fluency. These individuals continue to work, socialize, and function independently. Patients with mild cognitive impairment progress to a dementia rate of 10% per year. The last stage is dementia, which includes increased memory loss and confusion, inability to learn new things, and difficulty with language and problem with reading, writing, and working with numbers. Difficulty organizing thought and thinking logically. Shortened attention span, which means the shortened amount of time spent concentrating on a task before becoming distracted. Problem coping with a new situation. Here I want to discuss about diet and lifestyle for delaying or improving Alzheimer. To date, approved drugs have shown modest clinical benefit in delaying the neurodegenerative process, and currently the Alzheimer disease epidemic is facing two major problems, both the lack of effective drugs and the need to delay cognitive related disability show the importance of nonpharmacological strategy to stop or delaying this global problem. In line with this, many clinical studies indicate the role of nutrition and lifestyle in preventing or delaying brain neurodegeneration. Lifestyle modification includes at least 150 minutes per week of moderate to vigorous intensity physical activity. Physical activity as an important part of healthy aging. Maintaining the normal weight, not smoking. Established research has confirmed that even in people 60 or more who have been smoking for decades, quitting will improve mental health. Light to moderate alcohol consumption, which means not more than one shot per day. Limiting the use of alcohol improves cognitive health. Control blood sugar if you are diabetic or pre-diabetic. Control high blood pressure and cholesterol. At least 6 hours per night sleep. Lifelong learning and social engagement, practicing in social events, playing an instruments, reading, playing board game, dancing, creating art, and other activities that require mental and social engagement. The other important part is nutrition. The MIND diet is a combination of the Mediterranean diet and dietary approach to stop hypertension, or DASH diet. I highly recommend to you guys view the DASH diet video that I provided before. Indeed, the MIND diet is based on traditional eating habits in Greek, Southern Italy, and other Mediterranean regions are characterized by high consumption of fruits and vegetables, cereals, legumes, olive oil, nuts, and seeds as the major source of fats, moderate consumption of fish and poultry, low to moderate consumption of low-fatty dairy products, and using moderate alcohol, especially wine, and low intake of red meats. Okay guys, we enter the end of discussion. If you have any question, leave a comment below. Make sure to like and subscribe so you could be able to watch my future videos. Thank you for watching and being careful about your health.